Namaste, friends. Today I am going to speak about case taking in homeopathy. As all of you know very well, case taking is a very important step in homeopathy. The entire outcome of the treatment depends upon how well we have taken the case. Hahnemann mentions in his aphorism, once the picture of the sickness is accurately sketched, the most difficult task is over. That means Hahnemann is telling tracing the picture of the sickness is one of the difficult tasks. We need to carry out this process very well. It may require some time to learn this skill. Kent says a well taken case is half cured. That means so Hahnemann, Kent, they are emphasizing the importance of proper case taking. Having the skill and knowledge of proper case taking is very essential to become a good homeopath. It is ABC of homeopathy. Unless the case is not well taken, so we may not be able to find the right remedy. To scale up in homeopathy, a very good knowledge and skills of case taking is very, very essential. Let me tell you, many times I ask my students, my friends, how does our case taking starts? Many times I hear from them that our case taking starts with preliminary data, their name, age, sex, occupation, marital status, address, then the parenting complaints, history of parenting complaints, past history, family history, personal history, then life space investigation, etc. Fine. But in fact, our case taking starts much before we elicit preliminary data of the patient. In fact, our case taking starts if you are a clinician without receptionist, you yourself receiving the call of the patient. When the patient calls you for an appointment, the way the patient talks to you over the phone, his tone of voice, okay, whether he's anxious, whether he's dictatorial, dominating, the tone of voice will tell many things. You can get idea about the individuality of the patient when you receive the phone call itself. Suppose if a patient calls to the doctor for appointment, one patient calls, sir, good evening, sir. So is it Dr. Shivshankar, sir, clinic, homeopathy clinic? Sir, I want an appointment, sir. At what time I can get, sir? This is one patient. The other patient calls, sir, good evening, sir. Sir, my friend referred to your clinic, sir. I'm suffering so and so. Sir, can I get an appointment, sir? Okay, thank you, sir. I will come at 7 o'clock, sir. Thank you, sir. This is the second patient. I will tell you about the third patient. Hello, is it homeopathy clinic? Is it Dr. Shivshankar clinic? Sir, namaste. Sir, my friend referred to your clinic. He spoke a lot about you, sir. Sir, I have gone to many hospitals, sir. I am tired of my complaint. Sir, I want an appointment from you, sir. Yes, sir. I will come at around 8 o'clock, sir. Thank you, sir. Thank you. So in these three instances, what did you observe? The first patient was anxious. You could see the anxiety over the voice. Okay, he was apprehensive whether he will get the appointment or not, whether he was apprehensive to talk to doctor. In the second case, patient was expressing himself very well. He was cool, calm. In the third instance, patient's voice was loud. Okay, so the tone of voice will tell many things about the patient. Sometimes I also receive the patient. Is it homeopathic clinic? I am so and so. I want an appointment from you. Can I come this evening at 6 o'clock? Some patients who are somewhere working as authorities, or sometimes even SDA or FDAs working under some under authorities. Sometimes they call over the phone. They speak with an air of command. The way they talk, the tone of voice will tell many things about the peculiarity of the patient. This is the first step if you are receiving the phone call by yourself. Second thing is when they enter and wait in our waiting hall. Some patients I have seen, I will be seeing the patients. Some of the patients who are sitting in the waiting hall, they come and peep into my room twice or thrice. They are very hurried. Sir, can I come in, sir? Can I come in, sir? Some patients, they sit in the waiting hall. Sometimes even if there are no patients, if I am reportaging for previous case, unless I call their name, they will not come inside. They will be waiting outside. In the first instance, the patient was very impatient. The second instance, patient was cool and calm, very submissive. The way they enter our chamber, there also we can see the individuality of the patient. Some patients enter our chamber. They enter our chamber by asking permission. Sir, good morning, sir. Sir, good evening, sir. Can I come in, sir? They will come and sit in front of you on the tip of chair like this. Some patients, when they enter your chamber, they smile at you. Hello, good evening, sir. They come and sit in front of you, sit straight, with smiling face. Sometimes even many patients have asked me, how are you, sir? They themselves are patient, but they ask, sir, hello, sir, how are you, sir? And third type of patient I have seen, they may not ask, they may not seek permission. They come and enter our chamber, sit straight with bending backward, like this. So the way they enter our chamber, the way they sit in front of us, will reflect the individual temperament of the patients. In the first instance, patient was anxious, timid, yielding. He is apprehensive. He takes the permission of the doctor to enter the chamber, comes and sits in front of the doctor on the tip of chair with bending forward. He is anxious. In the second instance, patient is smiling by seeing the doctor, entering the chamber, sitting relaxedly, calmly, and asking the doctor, hello, sir, how are you, sir? He is a friendly, outspoken person. In the third instance, patient is entering, sitting with bending backward like this, haughtily. So, till now, we do not know the name of the patient. Sometimes patient comes without prior appointment. I don't know the name of the patient, his age. But I observe, much before I know the name of the patient, age of the patient, what profession he is doing, what is his complaint, I observe how the patient enters, how they sit in front of us, how they talk, their demeanor, tone of voice, the way they talk, facial expression will tell many things about the individual aspects of the patient. So that means from this video, you might have come to know very clearly that our case taking starts much before the preliminary data. That is observation. Observation is very, very important in our day-to-day clinical practice. To summarize this video, our case taking starts much before the preliminary data. If you are receiving the phone by yourself, the way the patient talks to you over the phone, you can get some idea about the patient, the individual personality of the patient. And the way they enter and sit in our waiting hall, and the way they enter our chamber, the way they enter, the way they sit in front of us, the way they talk. By this, we can gauge a lot about the individuality of the patients. In the next video, I will explain about preliminary data, presenting complaints, history of presenting complaints, etc. Thank you.